I am a clinical neurologist. I direct the Alzheimer's Disease Center. Our center focuses on a life course approach to understanding causes and consequences of cognitive impairment using a variety of tools. We focus on community-based programs, mostly of diverse individuals.
My area is epilepsy and cognitive problems. So what we find, we as neurologists, we often focus on epilepsy by treating the seizures, and we can treat the seizures very well with medication. However, what we find is that a lot of these individuals continue to have cognitive problems. And so the question is, how can we get these cognitive problems under control? My goal is to really kind of understand these cognitive problems so that we can begin to find treatments to specifically focus and target these cognitive issues, these cognitive deficits, because we do know that long-term, these cognitive deficits get worse over time. And so what I do is that I use EEG and fMRI to kind of understand what are the activation and connectivity problems going on, and how can we connect them or relate them to the specific cognitive problems.
My research program it spans both animal research as well as human cognitive research. The questions in the lab are really centered around epilepsy, sleep, and cognition. The animal work that we're doing at present is the nexus of all three. We're looking at the way that epilepsy disrupts sleep and what role that may have in cognitive impairment in epilepsy. And in human subjects, we're looking at the neural circuits of recognition memory at the moment, using SEEG patients, so using intracranial recording and stimulation techniques, and the stimuli are using virtual reality approaches, which is novel in memory research.
I work with primary brain tumors, which are the tumors that start in the brain and stays in the brain usually. Our research program focuses on studying serum metabolomics by checking the blood metabolites in patients with glioblastoma, and using that as a metric for following our patients and hopefully in the future being able to detect recurrence of the disease earlier than imaging. And in that case, we'll be able to help patients detecting the disease earlier and giving them the proper treatment.
I'm an engineer by training. I have a PhD in electrical engineer, but my heart and training is in MRI physics and image reconstruction. My lab, which is based in Davis, is called the Functional Advanced Neuroimaging, or FAN Lab, and we develop novel MRI and positron emission tomography, PET, tools to study the brain cerebrovasculature. So our models and methods can measure things like brain perfusion, oxygenation, and also how it responds to a vasodilation stress test. And these things can be really important early biomarkers of things that happen in cerebrovascular occlusions or stroke, and even vascular dementia. We hope our new methods can support the awesome clinicians in the neurology department.